Today, we're talking about the 6 secrets to healing your anxiety and depression that your MD doesn't want you to know. Hi, everyone. I'm Dr. Michael Johnson. I am a board-certified chiropractic neurologist. I'm in practice in Appleton, Wisconsin. I've been here since 1983. And welcome to A Day with Dr. J. Yes, 6 secrets. Now, the first thing I'm going to say is if you're on any medication for anxiety or depression, do not stop taking them. Let me say that one more time because not a lot of people get it. They're looking for a natural fix and then they stop taking the meds. Do not stop taking your medications. We need you here to help your body heal. So there are 6 secrets. We're going to cover them all today. First, I want to share my experience. I went through severe depression to the point of suicide. This was all the way back in 2001. I can tell you the exact day it started. September 6th. It was a Thursday. You can look on the calendar. I remember it. September 6th. It was about 6 p.m. at night. It was just like I hit a wall. And severe depression. I mean, depths. I would describe depression as a slow walk through hell on a good day. And there were bad days. It got so bad that in February of 2002, I went out to the local sporting goods store at the mall. I was going to buy a gun, stick it in my mouth, pull the trigger. I went and bought the gun. Walking out of the sporting goods store, I see a vision of my son, who was 9 years old at the time, Jens, and how it would devastate him. And then I see what it would do to my other 3 kids at the time, and my wife, and my mom, and my brother and sister. So I took the gun, threw it away, and I was really depressed because I wasn't healthy, number one, and I was depressed over some business dealings. I had some unethical people, let's just put it that way. Wasn't good. It was really bad. So I drove back to my office, called for help immediately. I was on medications. I didn't know it at the time, but there is a gut-brain connection. My gut was not good. So when you have inflammation in your gut, you have inflammation in your brain. I had a very bad parasitic infection in my gut from eating sushi. My eosinophils years later, this is 2008, were 26.4. Normal is 0 to 3. That's how severe my parasitic infection was. And I got that cleaned up. I stopped eating sushi. It went from 26.4 down to 8. And I took some anti-parasitic supplements, cleared it out, definitely helped me. Really helped me. So that's part of one of the secrets, is getting thorough blood work. You really want to see what's going on. You really have to see what's going on. And along with the blood work, you might want to get hormonal testing, depending on what the blood work looks like. There's something called the Dutch test. If you Google it, or go to dutchtest.com, just like it sounds, D-U-T-C-H, test.com. Yeah, you want thorough and complete blood work. You want to look at every aspect of your body. You want a complete metabolic panel. You want a lipid panel. You want a complete thyroid panel. If you have a thyroid issue, and I do, that can cause depression and anxiety. You want to look at homocysteine, inflammation in your system, systemic inflammation. Normal is 6 to 7. I've seen people with depression and anxiety with homocysteine levels of 30. It's insane. So, thorough blood work. You next want to do genetic testing. Go to drjgeneticsupport.com. That's drjgeneticsupport.com. Watch that video, because it's so important when it comes to anxiety and depression. Let me give you some concrete examples, okay? With anxiety, if you have a GAD1 gene defect, that's probably why you got the anxiety. You're not converting glutamate, which is excitatory, it's a neurotransmitter, a brain chemical, to GABA. which is inhibitory. If you're not sleeping well, you definitely have a GAD1 gene defect. You could have a genetic defect with MAOA. That's a gene that has to do with serotonin. Serotonin's your happy chemical, your happy brain chemical, your happy brain neurotransmitter. What they're trying to do with medication like fluoxetine is a selective serotonin reuptake inhibitor, SSRI. And again, keep taking your meds, but eventually let's heal your body so maybe you don't need them. Does that sound reasonable? I mean, it does to me, because your brain habituates to all medications for one thing. It gets used to it. That's why they have to switch the meds for some people. That's why they have to increase the dosage. But, why not get to the cause of the problem? And maybe you have an MAOA gene defect, and that's why your body isn't producing serotonin. The same holds true for a gene defect called MAOA or MAOB, which has to do with dopamine. Dopamine is the brain neurotransmitter, the brain chemical that allows you to be satisfied in life. There aren't a lot of people with depression and anxiety who are satisfied with their life. So, yes, that's a big one. And if that sounds like you, excuse me, I have no issue with counseling. I do have an issue with just popping pills all the time because you're not getting to the cause of the problem. And again, keep taking your meds. Another gene defect, FUT2, that has to do with that gut-brain connection again that we just alluded to with the blood work. What about MTHFR? Methyl tetrahydrofolate, that can be related to depression. CMOT. CMOT has to do with, especially with women, with estrogen levels. That can be related to depression. So all of these things come into play. VDR, I have the VDR gene defect. My body doesn't absorb vitamin D. So you see how you got to get to the cause of the problem. And yet, many physicians just want to write you a script and send you on your merry way. Homeopathy. Homeopathy is the third secret. So we've got blood work, genetic testing, homeopathy. I don't do homeopathy in my practice. I can't as a chiropractor, our nurse practitioner does, but there's a couple homeopathic products. One's called Rescue Cure, the other's called Field of Flowers. Work great to help patients with their anxiety and depression. We have another product called Serious Brain Enhancer from Doctors Research or Food Research that helps with patients. I'll have these all linked below. You don't have to write any of this down. But that can help people. But I can't stress it enough. Getting to the cause of the problem is a holistic approach. You have to look at the entire system. It's just not the genetics. It's just not the blood work. It's just not the homeopathy. We do stem cell therapy in regards to anxiety and depression when the cases are really severe. We'll do an intrathecal injection. An intrathecal injection will cross the blood-brain barrier, helps the brain to heal. So that's another secret that a lot of people aren't aware of. Another secret that your MD isn't going to share with you. We do functional neurology. Functional neurology is actually doing brain-based exercises or brain-based therapies, spinning in a chair, looking at an optokinetic tape, visual and auditory stim, listening to sound in one ear. Visual and auditory stim are two of the most powerful stimulants to brain. So we're going to do functional neurology along with blood work, along with homeopathy, along with genetic testing. So you see how it's this multimodal approach. And finally, diet. Obviously, when people are depressed, they eat emotionally and they don't eat the healthiest. You kind of have to work at diet, and with diet, I would include exercise. Exercise increases your good brain chemicals like serotonin and dopamine and GABA. So diet is a big one. A autoimmune paleo. You want to eat to decrease inflammation in your gut and brain. There's that gut-brain connection. So it's meat, fish, vegetables, fruits, nuts, and seeds. You want to eliminate grains because of the gluten in the grains causes inflammation. You want to eliminate dairy, all dairy, because the casein in the dairy is what causes the inflammation. You want to eliminate refined sugar. You want to eliminate soy. You want to eliminate caffeine and alcohol. All of those things cause inflammation in your gut and brain. I'm talking about getting to the cause of anxiety and depression. And it's not just one of these 6 things that I've just mentioned, it's all of them. It's a holistic approach. So let's review. Diet we just talked about. Complete blood work, very important. Stem cell therapy, homeopathy, genetic testing. All of these things come into play so that you can get better. Last but not least, functional neurology. So you want increased frequency of firing of brain. Those are the 6 secrets that your MD doesn't want you to know about. If he did, he would have told you. But the problem is a lot of physicians are limited in time. They've got here in Appleton, believe it or not, they got 5 minutes to see a patient. I can't tell you how many patients come to me and say, you know, I want to ask my physician a question, and they got their hand on the door handle. They can't wait to get out. It's no way to treat patients. So, I'm Dr. Michael Johnson. Thank you for taking the time to watch this. If you have a question, please email me. mljohnson@askdrjohnson.com. That's mljohnson@askdrjohnson.com. Please sign up and subscribe to our YouTube channel. We're releasing videos daily. We're at Dr. Michael Johnson on YouTube and the Optimal Health Stem Cell and Wellness Institute. So give this video a thumbs up. Subscribe to our YouTube channel. If you're on Facebook, please go to Dr. Michael Johnson, board certified chiropractic neurologist, and the Optimal Health Stem Cell and Wellness Institute. I'll give you my email just one last time in case you want to contact me. mljohnson@askdrjohnson.com. Like I said, folks, I've been there. And I know what a slow walk through hell it is in overcoming depression and anxiety. So if you have questions, contact me. You can comment below this video if you're on YouTube. Become a part of our community. And let's all work to get better. I'm Dr. Michael Johnson. Thank you for taking the time again. And don't forget, live from your heart.